Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back, everyone. We are back for the second half of our interview with psychotherapist, speaker, and self-described anger expert, Bronwyn Schweigerdt. Bronwyn gave us some really amazing insight into her history and her inspiration into working with shame and anger. And I honestly cannot wait to learn more. So, Bronwyn, welcome back.
Thank you.
Can you walk us through what it looks like when and what you actually mean by reversing trauma? So when somebody works with you and they, have experienced trauma,
Yeah.
how do we reverse that?
So I believe what makes trauma traumatic, because, they have shown that two people can undergo the exact same experience and one person develops PTSD and the other doesn't. So what I believe creates the trauma isn't the actual incident itself, but it's the suppressed anger or disassociated anger that is still in our bodies, held in our bodies after it. And not just anger at the person, a lot of times anger at ourselves. In fact, I would say the majority. So this was another study I ran into that actually found that PTSD was more linked with anger at ourselves than any other kind of anger. And then the other thing that makes it traumatic is the shame from that trauma. So those are really the things, the anger and the shame that we have not resolved, that we have not worked through.
Absolutely. And I would also add the avoidance. The avoidance of those really distressing feelings is another reason why trauma and PTSD continues to present itself. So how do we go about reversing that?
Yeah. And I also want to say, I heard this term a few years ago. I have endorsed it ever since. I've heard there's the trauma behind the trauma. So for children, so for example, I'm going to use an example. Let's say there's two children going through the same kind of bullying behavior at school. Let's say they're both 8-year-old boys. And let's call the first one Tom and the second one is Terrence. Tom has a good relationship with his mom. He has a mom who really listens to him, that validates his feelings, that supports him. And so Tom is bullied as an 8-year-old at school, but he's able to tell his mom at home. And mom says, you know what, Tom, that sounds humiliating. That sounded really humiliating. And Tom says, yeah, it is. And his mom says, what do you think you need when you feel that way? And then Tom's like, I think I need to tell the teacher. Okay, sounds good. Okay, that's a perfect mom scenario. Most of us are not like that. I sure wasn't myself. But that's a great example. That first boy, Tom, is not traumatized by the bully. There's no trauma because he's able. So what's shareable is bearable. He is sharing his feelings about what's going on with his mom. His mom's like resonating with those feelings. She's showing empathy. She's validating. She's naming, you felt humiliated. What do you need to do? He's getting everything he needs through that relationship. And through it, he's learning to trust himself because she's saying, what do you need? She's not going and telling the teacher for him or the principal. She's saying, what do you need, Tom? And then he's like trusting himself to do it. So this little boy is going to grow up to be a very healthy person. Let's say Terrence, he's getting bullied, but he doesn't have a parent that shows any attunement at home. So you know what? Most kids like Terrence, whether it's bullying at school or sexual abuse or what have you, they don't tell anybody. And that's the trauma behind the trauma. Not just that they don't tell anyone, but that they're smart not to, because they would feel more humiliated and more alone and more isolated. It would be more painful to open up to a parent and say, I'm getting bullied at school, and the parent not showing any concern or making it feel like you're the problem. Well, what are you doing, Terrence? What are you doing wrong? Right? That's more traumatic. So Terrence isn't going to say anything, but he's holding all of that humiliation inside, that shame from the bullying. He's holding his anger at the bully inside. He is going to experience trauma. So it's the trauma behind the trauma. So that's what we need to focus on. And that's why having a good therapist, but also a good parent, a good friend, and being that person for ourselves, where we validate our own feelings, where we say, you know what, Bronwyn, you are allowed to feel as much anger, as much rage, as much hatred right now as you want. Your feelings matter. They are valid. And we're going to allow those feelings to give us wisdom for our next step forward, what we need to do. We can trust ourselves to put those feelings to use in a healthy, productive way.
I love this. So would you say that it's the validation
Mm-hmm. Yeah.
of the anger and of the incident, that especially if it's in the past and they didn't receive that before,
Mm-hmm.
that's what helps reverse it?
Yes.
And if so, w- what are where are they coming out on the other side of this? What do you see as the result?
Well, I would say, first of all, it is the validation. But by the time people come to our offices as adults, it's not, our job isn't just to validate them, because most people aren't even feeling their feelings. So someone who's like, I'm really angry because that happened to me, those are the easy folks. But a lot of people are like, I don't know what to feel. I can barely even share this. I don't think it really matters. And so our job is to be like, you know what? You need to feel, and your feelings are valid. And our job is actually to be very evocative. A good therapist is like, what did she say? Are you kidding? Right? So our job is to evoke those feelings, because most people are so dissociated from their feelings before we can ever get to validation, right?
Mhm. Absolutely. And I think that, you had mentioned that when this happens and they're not validated,
Mhm.
they embody shame.
Yes.
And shame, I see, and you can probably validate this with your work in nutrition as well. I see so many people who struggle with either eating disorders or disordered eating, especially when it comes to emotional or comfort eating, that they're primarily driven by shame. That's also kind of on top of repressed anger.
Yeah.
Would you agree with that? And give me a picture of shame and what that does to the body.
Yes, I agree with that. So I see shame as the same as disgust. And shame is a type of self-disgust, which is also hatred. So all these things are synonymous. It's self-hatred. Shame is self-hatred, self-disgust. Um, and so I see it definitely, like you're saying, is related not just to eating disorder or disordered eating, but I would say probably almost all gut disorders.
Mhm.
And it is shame. And my own experience when I was invalidated, when I wasn't given empathy by my husband 16 years ago, I couldn't stop eating. I felt hollow. I
Mhm.
felt like empty because my attachment figure wasn't showing up for me. And so I couldn't stop eating, right? And then I'm also feeling shame. So I'm vomiting all the time out of nowhere. So I'm feeling both the emptiness that I think little Bronwyn felt at age 3, and the shame at,
Mhm.
vomiting it out. So absolutely, that's what shame does to us. And it also evokes that emptiness we feel, that we feel unloved. That brings that up from our childhood.
Yes, absolutely. I would also say that shame is often behind substance use
Oh, yeah.
disorders as
Oh, yeah.
well. And when you look at it, they're very similar. Comfort or emotional eating and substance use. They do provide kind of a mental escape from all of that pressure and pain that they're feeling, a way to dissociate, a way to fill a
Yeah.
void, whether it's, with a substance that kind of takes you away from reality, or it's, food that's helping to kind of fill that emotional void. So, how do
Mhm.
you help people resolve the shame?
Yeah, and I will actually add to that, I believe OCD does the same thing. It's a one gigantic distraction to dissociate from the shame and the anger. Depression, anxiety, those are not feelings. Those are not emotions. Those are dissociations from feelings. So
Mhm.
the whole gamut, mania,
Yes.
um, psychosis, all of that. But yeah, so how do we deal with the shame? That's why I do my integration exercises. So we feel the shame, we become that attachment figure for our young self at that imprint, the imprinting memory. We have to go back to I believe we have to go back to the imprinting memory. And when we allow ourselves to feel our bodies in the present, when that shame is being evoked, when it's being triggered, and to feel that sensation in our bodies and let our minds float back, it will take us to an imprinting memory of ourselves at 3, 4, 5, whatever age. And then we can go and we can dislodge that shame. We can say, little Bronwyn, let's put all that shame in this big cardboard box and we're going to give it back to the parent. We're going to give it back to the bully, or we can just throw it in the sea because it's not ours. It's
I think that's so beautiful. You were just mentioning some more severe mental health disorders like bipolar and
Mhm,
psychosis.
mhm,
How do you help them navigate these more severe mental illnesses with, the use of emotional reconnection? And what have those cases taught you about the role of expression in
yeah.
healing?
Yeah, I have one client in particular. We've been working together for probably 2.5 years now. She's given me permission, I don't use her name, but to share her story because she is I'm so proud of her. She's my ultimate success story. She suffered with psychosis for, I would say, 13 years before she came on as my client. And I just remember the first time ever talking to her, and she's like, "I'm sick. I'm the sick one in my family. I have all these mental illnesses." And I'm like, "It sounds like you're the actually sane one, the only one that has feelings, and your feelings are really valid." And once she was able to see that even her hallucinations, she had, kind of dementors, from Harry Potter, the dementors, the soul suckers. She had those. She would see hallucinations of those. She would see a witch that was trying to kill her. She would hear voices here and there. She started seeing, I'm like, that kind of sounds like your mother, don't you think? It sounds like your body is trying to tell you to stay away from your mother. It's trying to warn you about her. And now she's like, "Oh, yeah, that is exactly what that was." So she
Wow.
was refusing to see how wicked, how horrific her mother actually was, and the minute she started opening her eyes to that, she had complete boundaries, completely cut off her mom. That was about 2 years ago, and has not had one hallucination since that time for 2 years straight now.
Wow. That's amazing.
And what made the mother so sick at the heart of that was how incredibly invalidating she was. So that's why I really press on this point. One common phenomena I see with people with severe sickness, is a very consistently invalidating parent.
Absolutely. That is really amazing to hear that the hallucinations stopped after she
Mhm,
made that realization. And I think, it's really hard for people to actually look at their parent in that light. I think that that's why they have so many struggles and they internalize it
mhm,
because how could my mother, the person who's supposed to taking care of me, who's supposed to be loving me,
yeah,
how could she be that person? So it can't be her. It's
yeah,
got to be me. And when they actually do make that connection, you do see a rift happening. And I think that that's where some people will go, no contact,
mhm,
or some people will distance themselves as
mhm,
they're kind of working through this. And
mhm,
I often find that no matter which way they go, but if they do go with just distancing and not separating, I
mhm,
see them go through this process that I think is really kind of beautiful, where,
mhm,
they work through their anger, they're realizing how pissed off they are at their parent, and it may disrupt relationships as they're hanging out together, as they, do the holidays and things like that. But when they stick with it and they continue to work through that, what I actually see happen with my clients is that eventually the anger resolves itself, and then they see the parent very clearly, and they see all of the factors that led to the parent being this way, and they actually develop empathy and compassion
Mhm.
for the
Yeah.
parent. On the other hand, I see, when they report back with these like family interactions, when the client actually changes their behavior and they're no longer falling into those
Mhm.
patterns and
Yeah.
they develop those boundaries,
Yeah.
that's actually when they see the behavior of their parent change in a way that's more healthy,
I
in
believe
a
that.
way that's
Mhm.
better for the relationship. And I think that actually helps to increase that empathy and compassion.
Yeah.
So, it's really interesting. And I think a lot of people do have to completely sever ties as well. And that's
Mhm.
very hard for people. And they need all of that extra support as they're
Mhm.
doing that.
Yeah.
But making those realizations can resolve some really severe mental health
Mhm.
diagnoses. And I think that that's absolutely beautiful. So now we've talked a lot about parents not necessarily doing the best thing.
Mhm.
What are some ways, if there's parents out here who are like, oh my
Mhm.
gosh, I don't want to do this to my kid? How
Mhm.
do I figure this out? How can parents raise emotionally resilient kids
Yeah.
without teaching them to suppress these difficult feelings of anger
Yeah.
or grief or shame?
Yeah. Well, that's the hard part is we have to validate their anger at us ultimately.
Mm,
And that takes us developing that ego strength to be okay, to be seen as imperfect in our own eyes. And we
mhm,
need to know when they're angry at us, that is not shameful because we get to be human. Really, it's about us kind of embracing our own humanity and saying, you know what? I'm just a human. Humans, you know what humans do best? They make mistakes. We make so many mistakes. We're so good at it. And the best humans learn from their mistakes and see it
mhm,
as an opportunity to grow wiser. And that's who I'm going to be. And with my child, that's who I'm going to be. So I'm going to learn to attune to them. And even when they're angry with me, I'm going to learn as hard as it is initially to go, okay, Susie, yeah, I can see where you're coming from. I can hear that.
mhm.
That's okay.
Wow.
I don't blame you for feeling frustrated with me when I say this, but I do that. Yeah, get
Yes.
it. You're right. You're right to feel annoyed when I am being kind of hypocritical. Thank you for pointing that out. Thank you for bringing that to my attention. I'm going to work on that. I'm going to grow and be a better human. And when we can be a human and model being a human for our kid, which means listening to them, being taking it in and responding with an apology, owning it, and then changing and growing from it. We model being the best human, and they are going to walk in our footsteps. We are giving them the best gift on the planet because they're learning, oh, I get to be human. That's what humans do when they make mistakes. They own it, they apologize, they change as a result. And we're gonna have the best damn kids in the world if
Oh
we do
my gosh.
that.
I was joking around, but I'm not really joking. I think, well, we have to take a driver's license test to become drivers. Why don't we have to take a
Yeah.
test to become a parent? And I agree with you. I think one of the worst thing that parents can say is because I said so.
Mhm.
Right? If they can help a child understand maybe why there's a rule,
Mhm.
or take the time to really hear what their
Mhm.
child might be resisting in
Mhm.
them and understand where they're coming from and validate that and have humility
Yeah.
to say, you know what? You might be right. I might be wrong. And let's really kind of work this out. You're
Yeah.
you're modeling this behavior for your child.
Yeah.
And I think parents just feel like they have to be the authority, and that makes them more authoritarian. But
Mhm.
done tons of studies on parenting, and
Mhm.
democratic parenting is the most effective and
Yeah.
healthy style of
Yeah.
parenting.
Yeah. Well, I don't like the term democratic. I think maybe the best one is, so there's authoritarian and there's authoritative.
Mhm.
I want to be authoritative. So if I say to little 8-year-old, Johnny, I don't blame you for being mad that I'm not giving you that cookie. I don't blame you. It doesn't mean you're going to get the cookie though. So I'm still the
Mhm.
authority, but I'm not authoritarian. I'm
Mhm.
authoritative. So I can
Yes.
validate his feelings. It doesn't mean I'm capitulating at his every whim. And then there's going to be other times where I'm like, you know what? Let's figure out a way that works for both of us. Let's work together.
Mhm.
And so now I'm helping Johnny trust himself, learn how to be a team player, right? I'm empowering him.
Mhm.
Let's find out a solution together. So
Absolutely.
that's authoritative. But yeah, the underlying spirit of democratic, same thing, absolutely.
Yes, I would agree, and I think especially when they're young,
Mhm,
authoritative is absolutely imperative, and
mhm,
as they transition towards preteens and teens,
mhm.
I think that that's when you can give them a little bit more autonomy
Yeah,
and be a little bit more democratic. Still have to be authoritative,
yeah,
don't
mhm,
want them
right.
out until 4 in the morning or anything like that,
Yeah, yeah,
uh, but giving them a little bit more freedom to feel independent or to feel like they have,
yeah,
some sort sense of autonomy is so empowering, and it's
yeah.
also modeling how they can become that way as parents themselves. So
Mhm,
let's switch a little bit. I want to talk about um, the medical establishment and how medication
mm.
is used sometimes in a way to suppress
Oh,
emotions,
yeah,
to suppress anger.
yeah.
How can we help, psychiatrists who are,
Mhm,
prescribing these medications, or how can we empower people who are on them
mm.
um, to work with their medication or maybe to choose a different route when it comes to their emotions?
Yeah, yeah, there's kind of this, I think what you're naming, what I'm hearing is this underlying pervasive, tacit belief that emotions might be pathological. And I definitely, getting back to the client that I shared who did have psychosis for those 13 years, she has had so many times in psychiatric facilities over those years, and she was traumatized every time because she very much was made to feel there like her emotions were pathological. And that's kind of the underlying, I guess the ideology around medication, right? Is like, let's numb your emotions, let's numb them. So, someone who's depressed or anxious is already numbing them because
Mhm.
they're already dissociated from mainly the anger or the shame. So what, those pharmaceuticals are doing is just numbing them more or numbing them from their already numbing them, right? So I've had clients actually tell me, I want to get off my meds because I need to feel my feelings now in therapy. So I think really it would be great if we could all get on board. Like that is the ultimate objective, right? Whether you're pro or anti medication for short term, the long term objective, maybe we can all agree around, is that we should all be feeling our feelings, that feelings are not pathological. Even anger is not
Mhm.
pathological. And we should all be committed as a community, medical community, maybe as a collective whole, to knowing that feelings are not pathological.
Absolutely. And I think it really does harken back to olden times, Bedlam days, and things like that, especially when it comes to women.
Mhm.
Women's
Yeah.
emotions, were deemed hysterical,
Yeah.
and they were discouraged,
Mm.
and so it became easier to put someone on medication or to call them crazy or
Yeah.
hysterical as a way to kind of suppress them and keep them under their rule of law. So there's a lot of history behind the use of medication, especially in women, and I think really empowering women to know that anger is okay, that it's okay to express it, that there are healthy ways to express it. There are healthy ways to establish boundaries might keep people from ever having to go on these medications. And on top of that, especially when it comes to antidepressants, they are meant for short-term use.
Mhm.
The way that I, talk about them with my clients is, when you're really low, and that might be because of a lot of factors, including nutritional deficiencies,
Mhm.
it's really hard to just even kind of come up to just that little level of homeostasis. And that's where the medication can be really helpful
Mhm.
as you're working through all of these difficulties and problems. And once you get to a certain level of functioning, that's when they're actually meant to be, slowly titrated down. And so I
Mhm.
think we need to be a little bit more aware that, we're not meant to be on these things for
Mhm.
life. And there are plenty of ways to wean yourself off these medications, especially if you're bolstering both your mental and your physical health.
Mhm.
Ugh, I could ask you a million more questions. Well, we're running out of time. I would love for you to tell people how they can get a hold of you, how they can work with you, where they can find your podcast, all of that stuff.
Yeah, absolutely. So mainly my podcast, that's really what I want to get out to the public. That's kind of my passion, where I talk about all this stuff with wonderful, well, mainly just me talking these days, but with wonderful people like you, Supatra. And that is Angry at the Right Things. And I also have a YouTube channel these days. So yeah, I would love for listeners to do integration exercises for themselves and dislodge that shame that doesn't belong in your body and come back to life, because that's what really happens.
Yes.
Yeah.
Yes. So, everybody, you need to go and listen to this podcast. And especially if you are struggling, and just know that your struggle is universal.
Mhm.
Everybody feels these emotions, all of these, quote, darker emotions that we don't necessarily talk about. I think it's so vital, so important that we do talk about it, that we do explore it. And I encourage people to also shop around. You do not have to stick with the first therapist you find. And most often, you may have to go from person to person until you find the right fit.
Mhm.
And just so you all know too, doesn't even necessarily matter the modality they're using. It doesn't matter,
Mhm.
whatever treatment integration they're using. It really does matter how you feel with
Mhm.
them. It's the relationship between you and the therapist. So I encourage people, don't give up. There are so many wonderful therapists out there. You might have to weed through a couple bad ones, but I encourage people to really get out there. And if cost is an issue, there's a wonderful thing called the Open Path Collective. And there are a lot of people out there who are providing sliding scale services as well. So don't give up. Get yourself some help. Go listen to Bronwyn's podcast. And we wish you the best in your healing journey in terms of resolving your anger and resolving your trauma. So thank you so much for joining me, Bronwyn. You're really illuminating.
Thank you, Supatra. It was really fun.
Yay, I'm so glad. Well, and thank you everyone for tuning into the ANEW Insight podcast. I'm really looking forward to our next exciting interview, and I hope you join me next time. Thanks for tuning into the ANEW Insight Podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.